So as chiropractors, we adjust patients on a daily basis. We get used to seeing patients recover from pain and injury. It is commonplace for us to achieve incredible results with our patients because we expect great results and typically get them. It's easy to forget there are additional factors at work with our patients, like who's fit, who's unfit. So although patients experience incredible results from their adjustments, we can overlook the importance of a healthy and natural diet. So seriously, I don't know anybody else that kind of stumbled onto this the way I did. So, back in the 90s, we had the MD, PT rehab clinics, 75 employees, my own MRI machine, two clinics. It was pretty cool. By the way, 30 of them were in my marketing out of 75, 30, almost half. That's how important marketing is, right? Billing out all these, 70, 100,000 a month services. So we're helping, work hardening, work conditioning, unweighting. We had this machine called the new back, new neck, where they were on a harness, unweighting with lasers. And anything that was out there, we were doing. But we're helping about 70% of them. And of course, when you're billing insurance, they get 12 visits, 20 visits or whatever. And then after, their 20 visits is up, you do a reval and you're like, well, I do feel better, but I'm not out of pain. I'm not where I wanted to be. So this happened quite a lot. So I'm thinking, okay, there's 30% that aren't getting the results. What's going on? So I did a scan on them with a machine I had called the biomeridian scanner. And I scanned, as I was scanning them, I found out there was a weakness. Those of you who have heard me before, the gut, the microbiome. So I thought, if this is low, let's work on that. It made sense to me. So we did that. Next thing you know, so with nutrition, supplementation, gut healing nutrients, herbs and such, and they're getting out of pain. And I'm thinking, what the heck is going on here? So that's kind of how this all started. And that's what I do a lot, mostly now when people come in, I look at the gut. I treat the whole body. So chiropractors, if you're treating any pain, you got to go to the microbiome. In fact, again, Google microbiome, and you'll see Google microbiome versus joint pain, DJD, rheumatoid arthritis, and you'll see that all roads lead back to the gut microbiome. Okay. I know you heard this before. This is my passion. So as chiropractors, we adjust patients on a daily basis. So we get used to seeing patients recover from pain and injury. It is commonplace for us to achieve incredible results with our patients because we expect great results and typically get them. It's easy to forget there are additional factors at work with our patients, like who's fit, who's unfit, not mentally, but like physically. Like when you do, like last couple weeks ago, I did one on personal injury. When people who are getting in a car accident, if they're more active, if they go to the gym, if they're fit, they're eating a better diet, they're going to be so much better in recovery from an accident. Then there's the couch potato that not so much. They're going to go way over budget. The lean's going to be so big, and you're going to have attorneys cutting your lean because this person's a couch potato. So be careful who you take on, and then get them on the nutrition like we did last webinar. So although patients experience incredible results from their adjustments, we can overlook the importance of a healthy and natural diet. I think I've said this before, but there are some schools, chiropractic colleges, that actually send down students to third world countries, and they'll be down there, and they'll be down there for like a week or two in between semesters, quarters, and they're working on these people, the third world people, and of course their diet is a lot better than ours. And like a little 2-year-old who hasn't been able to really walk yet, so you adjust him. Next thing you know, he's walking, he's running. That's not a placebo, it's just so cool that when you can adjust somebody that actually is non-inflammatory, the results are even more profound. So if patients eat foods that exacerbate inflammation, hinder the body's natural healing process, they'll find it's much more difficult to alleviate aches and pains. But so what do chiropractors do? They go buy the new and latest gadget, from Graston, taking the top part of the skin and just grinding it down, taking all the scar tissue out, to what's the latest that's been out for a couple years now. Let me think. Shockwave, not just for the body, but ED people are using the shockwave too. Yeah, it's cool. It works for a lot of different things, but again, temporarily. It's just working temporarily. So we need to start educating our patients. And if you want more information, I can show you good, better, best eating programs for patients. Okay. When a patient makes Poor nutritional choices, toxins in the body can cause many problems that can contribute to pain, inflammation, swelling, diabetes, arthritis, obesity, depression, heart disease, and even cancer. In fact, there's some recent studies that people with um, AFib, and they're going in and getting ablation, every once or twice a year. Studies are showing now that if you change their diet, literally change your diet to like more of a plant-based diet, within 3 weeks, AFib's gone. In fact, I work with a doctor here, and I've been telling him for years to do this because he's had, I think, 6 procedures. So he finally, after his last procedure, he went on the program I have, and he hasn't had any problems. He's lost like 35 pounds. He feels amazing. He's 71 years old. So, I mean, this is good stuff. And he does just nothing but pain management. And so he's starting to see how changing the diet up can help his patient base because it's helped him. As a chiropractor, you can teach your patients how to make better nutritional choices by providing simple dietary guidelines and pure supplements. You can help ensure that your patients get nutrients needed to support optimal health. You look at this chart, eat this, don't eat this, but eat this. If you sat down and talked to your patients, 80+% of them are going to eat stuff like this. You go to a store, a market in your area, and at the deli, what do they have over there that's already hot to go? Chicken fingers. And what are they boiled in? They're boiled in canola oil. I call it canola crap. And that's very inflammatory. And guess what's next to them? Oh a foot long? Are you kidding? Who doesn't love foot longs, right? With some ketchup, mustard. I just do mustard on mine. So anyway, well, okay, it's a quick story. During Christmas time, we went up to this fair festival, this German festival, and I did something naughty. I actually went in and I saw a foot long. So I did eat a foot long, and I ate a bratwurst. German. Oh my gosh, I had so much inflammation, pain. My L3-4 is a little bit thin because I did a lot of skiing, mountain biking, crashing. I forgot how old I was. And so that started to ache on me. So because I went off my diet, I started having some back issues for like 24 hours. This is what your patients go through every day because they eat that crap, all the time. So if we can change our patients to eat better, they're getting a better response from you. And you'll see where I'm going with this. Many of the nutrients found in whole foods can reduce inflammation and support the body's natural healing process. You can also recommend detoxifying cleanses that help maximize the benefit of new healthy eating habits. So, it's good to detox. You want a good detoxification program. This is one I use from Solutions 4. There's 3 bottles in there. You can do a 3-day, 10-day. So patients will drink this liquid mixture that we teach them what to do. It comes with 2 bottles, and they do that, taking the supplements for like 3 days to 5 days. We used to also have 10 days too. So I've had patients who've done it for, 20, 25 days. So I thought I got to do it longer than patients are doing. So I was going to do 30 days, but I made it to 28 because the next day was my birthday and everybody was saying, we got to go do something. I'm like, okay, well, I didn't eat that anyway. But there's a great way to do detoxes and cleanses I can help you with. Remember, drugs don't fix anything. So many patients may think that taking non-steroidal anti-inflammatory drugs will fix their problem. They don't realize that these drugs do not make any difference to the underlying cause, keyword cause, of their pain. Make the pain go away, they say all the time, right? Even if the pain goes away for a short time, the problem isn't, it's not solved without the right intervention. They make it even worse. Then again, this is why you get new patients every month coming in that are not new patients to chiropractic. They've been to other doctors. They're just thinking that, well, if you have a different technique, maybe you can help me with my pain because you have different procedures. Maybe you've got a DRX 9000, maybe you've got whatever. But you got to remember the DRX 9000, the disc has the same microbiome as the gut. So it's wearing out, degenerating because the gut is degenerating, wearing out. Get the gut back online. So when you're decompressing, you're, putting in the new fluids, the new blood flow circulation, it's going to heal, if you fix the gut as well. If not, they're paying thousands of dollars for nothing because, give them a few months later, it's going to come right back. Microbiome is the key. However, by cleansing the body and eating a healthy, natural diet, patients can solve the problems that cause so much pain and inflammation to arise in the first place. In the long term, making these types of changes can have positive effects in every aspect of patients' lives. And then you become the hero. You become the patient's hero. You're the doctor. Not only are we like the gatekeepers, but we should be the gatekeepers of everything. Because I've had patients coming in to lose weight with my program. They want a liver transplant waiting list. They did a 3-month program. Now their liver is functioning 60%. Never got a new liver. Kidney failure, dialysis, MS in the brain, no longer. I don't advertise that I treat that, cure that, or whatever. You can't say cure anyway. But the body can heal itself. Remember we learned in school the power made the body can heal the body? Well, I think most of us don't understand what that means, right? All right, let's fill in the gaps here. You can ensure that your patients are providing their bodies with everything they need to help to heal completely and successfully by teaching them how to fill in the dietary gaps as follows. Like, the brick and mortar. The mortar. The brick is like the cells, and the mortar is like the enzymes, minerals, vitamins. So we need to make sure we're filling that in because, you want to hear something cool? We always thought that, years ago, the soil was thicker, deeper, that would give plants the nutrients, that would give plants the nutrition. Where today, because they don't farm the right way in a sense, and they spray fertilizer on there and all that crap, herbicide, insecticide, pesticide. But even if it's organic, what really makes the food, the plant, is the soil. But what's in the soil? The microbiome, the bacteria. That's what makes the food even better than before. And if any spray, anything that goes there, it's not treated right, the microbiome gets killed, the quality of your food is not there. But try to do organic when possible. The bulk of a patient's diet should come from organic leafy greens and bright colored vegetables. I also encourage the consumption of organic fruit in limited quantities because fructose, too much fructose in the body, and glucose, 50% of glucose is fructose. Fructose has to be processed through the liver. Fatty liver is too much fructose. Okay, that's a fatty liver. We actually have a machine here called a Tanita. We can actually see if someone has a visceral fat. That's kind of a cool thing to see because that's what kills you, the visceral fat, right? The stuff we can't see. Organic poultry and eggs are a good source of protein. Wild caught fish, great omega-3 fatty acids. And then for cooking, cold pressed olive or coconut oil. But you don't want to cook it too high with olive oil because it could kind of damage that too. But you can just kind of lightly saute. One of my faves is taking some little round things, look like little Brussels sprouts. So you put a little olive oil with some Brussels sprouts, a little balsamic vinegar in there, and some seasoning. Oh my gosh, Brussels sprouts, cooked long term, just melt in your mouth. Really good. So we got to teach our patients to avoid the following foods altogether: refined grains, white breads, pastries, cookies, crackers, refined vegetable oils. I mean, vegetable oil sounds kind of like, hey, it's a vegetable. No. Soybean, canola, sunflower, they all kind of sneak it under that name. Or refined sugars found in soda. Remember, soda, even if it's diet soda, your pancreas doesn't know that it's sweetened with an artificial sweetener, and that still puts stress on your pancreas, releasing insulin. Large amounts of red meat, beef, pork, and alcohol. In fact, I had a patient in just last week, and he's like 60 years old. Came in for neuropathy, and so I was testing. I take a picture with a thermal imaging camera. I take a thermal imaging camera and I take a picture of his feet. And I did a treatment. So I get his toes were like 82 degrees, which they should be 95, 98. And I did a treatment. And after the treatment, I take another picture. Usually 90, 95% of everybody's toes goes up. Well, his toes didn't go up. So I looked at him and I talked to him a little bit more about his diet. And he drinks alcohol every day. And when you drink alcohol, it increases insulin. When you have increase in insulin, causes inflammation, swelling, and it's not a good thing for your blood vessels either. So he basically, he's coming in he's going to come in next week, but I said, let's try it again because this doesn't look good. Because if this doesn't look good, that means he's going to lose some toes in the next year or two. So you got to start thinking about not drinking so much alcohol every day, even if it's just wine and beer. In order to support your patients in the long term, I recommend that you pair the following supplements with healthy eating guidelines previously outlined, because even in 2002, the Journal of the American Medical Association, JAMA, came out and said, yeah, they conceded that everybody should be on a multivitamin, multimineral. So I want to do what I need to do to be healthy. I have a 2-year-old at home that just runs me rampant. So I have to make sure he stays out of the street. When he starts running toward the street, I got to run after him. I got to be faster than he is, right? Because, cars. And so let's team up with some great quality nutrition. One is this product that I've been using for many years and trained, like I said, 2,500 clinics, this protein shake. It's not just a protein shake. It's a meal replacement. The protein comes from New Zealand and it's grass-fed. but they isolate it. It's isolate protein, and they isolate the lactose and the casein, which are inflammatory to the body, and that can give you more pain too. So basically, dairy-free. It helps to rebuild tissue, repair nerves. So this is one of the things I also do for neuropathy. So they're on this because this is so with prebiotics, probiotics, vitamins and minerals, amino acids, it actually can pass through easier through the brush board and the small intestine and get down to into the bloodstream, and that can start feeding the feet. Because remember, the body heals from above down, inside out. The feet are the first to go. So this helps to start to replenish the body with nutrients. It's almost like a mama bird chewing her food and then spitting it into the baby bird. We have people here that drink this and they put it. No, I'm teasing. You have something like this that the patients drink every day, and within a day they start to feel better, sleep better, have more energy, and less pain in the body. Healthy oils, omega-3 fatty acids, are powerful anti-inflammatories that provide incredible healing benefits to the body. From flaxseed oil, rich in omega-3, vitamin A is an antioxidant, supports healthy vision. So these are some nutrients that I use. Now that salmon oil is sockeye salmon, because if you just go get some fish oil somewhere, look at what's in there: anchovies, sardines, and holy mackerel. Well, I threw in the holy there, but anyway, mackerel. These are lower quality of fish. The oils they get, even krill oil. But if you go to sockeye salmon, why is sockeye salmon, versus silvers and pinks and kings? Because I go to Alaska and go fishing up at Ketchikan, so I know the difference in the fish. But the sockeye, why is sockeye? Because sockeye are vegans. So in other words, they're eating the better quality food, so their oil is going to be much healthier, if that makes sense. Okay. Multivitamin, multimineral, B6 can help with deficiencies and arthritis, to help metabolize protein. Vitamin D, oh my gosh, vitamin D. Even if it's in the summertime, I take 3 a day. So I take 600 international units a day, even though it's summer here too. Not too much more than that, but vitamin D can also help with inflammation. It can promote bone health and absorption of calcium. In fact, they've done these studies where if two identical twins were in a car accident, and one of them was low on saturated vitamin D in the body, she's going to have more pain, more inflammation than her sister, who actually has, because of her diet, or maybe she's supplementing, she has a higher quality of vitamin D3 in her body, and that's going to be, she'll have less pain. And they've actually done studies between vitamin D3 and salmon oil, omega-3s, as far as it's just as good as NSAIDs, non-steroidal anti-inflammatories, how to decrease swelling inflammation, which is really important to know, because we always think that, I'm in pain, I should just take some Advil or something, right? No. Vitamin B12. So years ago, in fact, even today, there are people who still go to a physician, maybe it's a DO or a nurse prac, and they'll go get injections of B12. And so I thought, why don't we do this in a sublingual? So we made some products here with solutions for, and so we made some great sublingual. I take like 3 a day. I just put it under my tongue. I just kind of leave it there until it melts. It helps with brain function. Also, this is one of the things I put patients on that has neuropathy or any kind of nerve pain, because it helps in the regeneration and healing of nerve tissue. Very important. Antioxidants. Nice picture there. When free radicals are lost in the body, antioxidants are the magic ingredients to keep our cells safe. The best source of these are like fruits and vegetables. So there's the free radicals. The free radicals are like, I heard somebody describe this once, Dr. Murphy, if you know who he is. He said, so you're at this party, and a free radical comes into this party, and he's looking at you, and he steals your shoe. And now all of a sudden makes you a free radical. So he's stealing parts of you. So what is an antioxidant? Antioxidant is somebody else who comes to the party with a bag of shoes. So he's going around putting shoes on those free radicals to make them non-free radicals anymore. So they're just new nutrients to help calm the body down. Free radicals, again, mostly from our diet and what we drink, can affect. And free radicals are like little hatchets chipping away at our body, causing degeneration and wear and tear. Now, topical, for pain, we have a topical agent, well, Solutions for does, with menthol, camphor, and capsaicin. And so there are also topicals. So what I recommend is, the doctors, chiros, you squirt a little bit on your thumb, and you rub it. If you're giving a cervical, you rub it on the neck, rub it in, and then you do your, CMT, your manipulation. And the patient's like, because it helps them relax. It's almost like giving them a trigger point injection, helps their skin relax, their muscles relax. And then afterward, it's cooling. It literally lasts like 24 hours. And then they get up and they're like, oh my gosh, or put on their lower back and adjust them then. And they get up and they're going, oh my gosh, what did you do? This is like, I feel so good. What is that stuff? You say, well, actually, you can get it at the front counter. So then you can sell this at the front counter. And guess what else we've used this for? Ultrasound. So if you guys do any ultrasound on the joints, not the joints, the muscles, the lower back, you put this as the instead of the ultrasound gel, you put this. Oh my goodness. Amazing what it can do. Again, natural. That's what we're looking for. Helps, like I say, and then you take a shower later that night and it kind of activates it again. So much better than anything else I've ever tried. Anti-inflammatory gel. Now, when your patients change their diet and start using these anti-inflammatory nutrient supplements to manage your pain, they'll well be on their way to receiving the nutrients necessary for their bodies to heal completely, prevent further injury, and stay on track for long term. This product right here, I just did an email. Some of you may be on my email. I send out emails to thousands of doctors every week, but this one is my favorite for pain. Saturday, went on a hike. I have a 30-year-old little 2-year-old, 30-pound 2-year-old, and carrying this little kid around, going on hikes. I mean, we live in Salt Lake. We have mountains right here. But when I come back after like a couple hours of going up and down, I'm like, okay, because my L34, has already started from years. Doesn't hurt unless you have a corn dog or a bratwurst. You missed something I talked about earlier, Angie. By the way, don't eat a bratwurst or a corn dog. So I take this stuff, and it's like magic Oxycontin, but not Oxy. What it has in there, you have to go on Solutions 4. You can actually see the ingredients, but I take 3 when I get back from my hike, and then 3 before bed. And oh my gosh, you're like floating. It's the coolest thing. I don't know I know what they put in there, but it's like, I don't know what they got in there, but it's magic. So if you're seeing any pain patients, you should get them on the joint muscle relief. And they're going to love you for this because it's going to calm down the joints, the ligaments, and muscles. They're going to, it's like having a medical doctor in your clinic doing trigger point injections in their joints for pain. You don't need that. So in summary, these nutritional guidelines can complement traditional chiropractic care by providing a foundation for the treatments you provide in the office. When a patient eats a healthy, natural diet, fills any gaps with supplements, you'll find it's much easier to reduce pain and get the results that you're looking for. Not only will your patients get better results, but they'll also be more satisfied and not look for another doctor, because they've got the right kind of care in your office, which helps boost your business, ultimately helps you create the clinic of your dreams, so you never have to keep getting a bunch of new patients every month. You have all these patients that keep coming in and they keep buying products from you. So as you go forward, don't forget how important it is to provide your patient with the anti-inflammatory nutrition that they need to recover from pain and stay healthy for the rest of their life. So if you guys want any help with nutritional products and programs, text me or email me, or no, wait, there's a text. There's my cell number right down there. You can text me, hey, I want some more nutrition protocols for patients, and I can kind of give you what we have, what I do. And then that's my email. And then if you go to solutions4.com, you can kind of review what's in the products. And that's a picture of me back there in New York, right before I went and talked with Dr. Oz. So I've spoken to Dr. Oz a couple of times back in New York. Great guy. And so we talked about a lot of things. So I was doing some work with him across the nation with a bunch of kids, trying to get them on a better, healthier eating program. And I was working with the doctors that I coach to try to get them to kind of get the message out to kids in school, about eating healthier. And so, he was helping me. I was helping him. He was helping me with that. So, and then we had lunch. So we have lunch, and guess what Dr. Oz orders? Plant-based food, great nutrition. So here's a medical doctor that gets it. He gets it. You could have ordered whatever, and we're in his big building there. And so he orders this, and he asks me what I like. I say, hey, I'll have the same thing, like big salad with a piece of a wild caught salmon. So great guy. I hope him well in whatever he's doing now. But yeah, this information, contact me if you have any questions about this. I just talk about Solutions 4 because I've tried pretty much everything, and I've tested them all on my Biomeridian EAV device that actually tests amazing on patients. And since I've trained thousands of doctors, they're doing the same program. They get the same results I do. So it's like, why argue with success? So that's why I do that.